Troy University is participating in the Guide Safe program to monitor the spread of COVID-19. The program is 3 parts that includes return testing, which took place at the start of the semester, the Health Check app, and lastly is Sentinel Testing.
The idea behind Sentinel Testing is that they're trying to determine if there are individuals on campus who are asymptomatic but who are infected. So this gives us a chance to sample a population on campus and determine if in fact they're walking around infected but not showing the symptoms. This then allows us to pull those individuals out, put them into an isolated setting and get them out of what in essence is the rest of the community environment.
Testing takes place on Thursdays at the Elm Street Rec Center gym. Prior to testing, between 3 to 5% of the university's community is invited to take the test. Although you may receive the invitation, it is not mandatory to take the test, but the university does encourage you to do so.
So it's not just students who are being tested. We have faculty and staff who are also participating in the test. So it gives us a chance to see who the individuals are, where they're located by building, what associations they have with clubs or with organizations, what dorm they're living in. That then gives us a chance to look at that data and determine if there are any trending patterns occurring. Perhaps we may or may not have a problem in a specific dorm, or there may be an organization on campus that is showing a higher rate of infection than others. It also gives us a good idea of what the status of the campus looks like, whether we have hot spots or whether we're consistently keeping the case count down.
One Troy University employee explains his experience with being selected for the random testing.
I've never had a COVID test before, and I've heard all these stories about them touching like the back of your nasal cavity, and it was a very uncomfortable experience. But for this process, it was a lot easier and a lot quicker. I received an email, I printed it out, I went to the location and the time that was set up, and they took the paperwork, scanned it, and then they gave me a small Q-tip that I could do myself, and it helped me get to my own comfort level. And so I followed the instructions and took the test, put it in the tube, and sent it off.